Good afternoon. Mr. Zanoni and County Judge and Annette and others will be bringing you some more information, update on what we're proceeding through as we continue to fight our battle with the COVID. But what I wanted to talk to you a little bit about today is that we're all very interested in our testing and what we can do to improve our testing and keep it going. Well, I have one thing I'd like to let people know, that on Monday, July the 20th, there'll be testing from 9 to 12, at least at these 4 locations. That's Amistad Community Health Center, Mission to Mercy Medical Center, Coastal Bend Wellness Foundation, and the Men's and Women's Health Services of the Coastal Bend. And if you're wanting to get tested, if you haven't signed up, Annette can probably tell you a little more about it, but I believe you need to call those people directly, or whatever you need to do to get signed up to go do the testing. And the quicker you get tested, then the sooner we can begin to get that in the pipeline to get the results and help our community solve this problem. Now, one of the things that if you're there, as long as supplies last, at one of these 4 testing sites on Monday, the 20th, you'll be handed a little bag here just as a thank you from the community to taking the time to come get tested, so we can try to get this problem solved a little quicker. And these have been made available by funds from the community who have given to the Mayor's Disaster Relief Fund and the Coastal Bend Community Foundation. And in it, it's to help you stay safe and maintain your safe. You'll find you'll have a mask. You'll find to have a bottle of sanitizer gel that you can put on your bathroom counter or your kitchen counter, wherever you have it. There's also going to be a pocket-size hand sanitizer that you can use so that we can keep you healthy. And then finally, a pack of just some hand wipes, so that put you in your purse, your briefcase or something, so when you're going around, you can continue to keep yourself safe, because the gifts that have come from the community want to keep you safe, and so this is one way we're trying to provide that for you. And so at each one of these 4 locations on Monday, between 9 o'clock and noon, as long as the supplies last, you'll be able to get one of these Keep Healthy kits from the Coastal Bend Community Foundation with funds that were donated to the Mayor's Disaster Relief Fund. So we're doing what we can to try to encourage you, 1, to get tested, and 2, to keep you safe. And so we appreciate that very much. And we have been working all day long, and probably before the day started, and be working in the evening on working with our school districts. And the judge, I think, or Peter, will go into the details on that. And our health director will have some information on that, because we're working again to try to keep our community safe, both from the people that are working and those that are planning to go back to school. So this is something that you want to really stay tuned to. If you had a tendency to leave here in the next few minutes, well, please stick around, because those are some important issues that are coming up that the health district has, and also the judge and Peter have, in terms of where we're headed on that, trying to make everybody comfortable and feel good about continuing their education and yet protecting their safety. So I'll get out of the way at this point. Ask City Manager Peter Zanoni to come up, and then our Dr. Ram. Well, I can't pronounce his last name. Dr. Ram is next. He's our county medical director or physician or guru, or I'm not sure exactly what his official title is, but you come down and make your presentation. We're glad to have you. They may want to come clean the rostrum before I leave.
El día de hoy les quiero hablar sobre la toma de especímenes que estamos haciendo para mejorar el número de pruebas. Siempre y cuando haya suficientes recursos, se les va a entregar un regalo por parte de la comunidad, gracias a la Fundación de la Alcaldía. Ahí encontrará un cubrebocas, un gel antibacterial y toallitas desinfectantes. Esto es para quienes se les lleve a cabo la prueba el día lunes. Esperamos con esto ayudar un poco para que nuestra comunidad esté segura.
Good evening, everyone. I, your local health authority, Dr. Srikant Ramachandruni, I'm issuing a public health order imposing specified control measures and restrictions for public schools offering in-person instruction. Schools included in the order are all public independent school districts that have school boundaries in Nueces County. The following restrictions are effective today, July 16, 2020, as of the execution of the public health order. School systems shall not reopen schools for on-campus, face-to-face instruction until after September 7th, 2020. Virtual instructions shall be permitted as per school system's own plan. At least 2 weeks prior to reopening for on-campus instruction and on-campus activities, the school or district shall develop a plan to be submitted to the Corpus Christi Nueces County Health Authority for reopening of on-campus activities and instruction. The plan must be made available to parents and the public. Extracurricular sports and activities are excluded from the order. This order may be renewed or extended by further action if necessary. Thank you.
Acabo de emitir una orden para las escuelas que van a tener clases en persona. Existen varias restricciones. Entre estas, las escuelas no tendrán clases en persona hasta el 7 de septiembre. Al menos con 2 semanas de prioridad antes de que comiencen las clases en las escuelas. Cada escuela deberá de contar con un plan de acción, el cual debe estar disponible a los padres y a los residentes.
All right, good afternoon, everybody. I'm Peter Zanoni, Corpus Christi City Manager, and I'm going to just add a few things to Dr. Ramachandruni's information before I get into the statistics for the day. So the Nueces County Judge Barbara Canales, Mayor Joe McComb, and myself have worked this week with 12 different superintendents of the 12 different school districts that are either entirely in Nueces County or have some of their jurisdictional boundary in Nueces County. And so there's 6 school districts that are completely inside Nueces County, City of Corpus Christi. And then there's 6 that have some of their ISD boundary, half in or some portion in Nueces County and some outside of our county. So there's 12 school districts. So we worked with all 12 with them to develop consensus and agreement on the order that Dr. Ramachandruni has issued. And the school districts are very much in favor. There's no contention or opposition. There's a good partnership. Flower Bluff, I might add, did want to have and they have called an emergency school board meeting for next Tuesday at 6 p.m. Dr. Ramachandruni's order applies to all 12 school districts. We may have to adjust should the Flower Bluff School Board do something next Tuesday at 6 o'clock, I think is their meeting, 6 p.m. So the order that Dr. Ramachandruni read, that's going to be available on our website, that is being provided to all the school districts, that was signed just moments ago, applies to all 12 school districts, all grade levels as well. And so if there's a pre-K program, a kindergarten program, it applies to every single grade level that's in the ISD school system. It does not apply, you may have heard Dr. Ramachandruni, it does not apply to extracurricular, sporting, or other activities that the school might have. A lot of those are governed by other bodies like the ULI, as an example, with sporting activities. So it applies to school instruction, and so no in-classroom instruction is allowed until after Labor Day. That's basically the essence of the order. But we do have a statement in the order, and we have, and the districts actually brought it up to our attention, but we brought it up to theirs as well, that we're going to monitor this week by week or day by day, hour by hour actually, but as we get closer to that Labor Day, we may extend the order depending on how we're doing here in the county when it comes to COVID. And I think the school district superintendents were relieved, frankly. We know that they are scared. We know the parents are scared. We know the teachers are scared. The teacher unions are scared. So this gives everybody a little bit more time, while at the same time still being able to instruct students the same way we did this spring, remotely, using technology at the home or through pickup material at the school. There'll be a pickup packet option if somebody doesn't have computers. I know many of the school districts have said that they're buying computers or they're buying hotspot airtime, so persons that might not have that at their home can have it, and if they don't have it through those means, there'll be other ways of getting information to the families. So what this does is it does what we've been saying all along, which is the best thing to do at this point is to stay home, and that means stay home to learn, stay home to enjoy time, and stay home to the extent that you can as much as possible. Okay, so we'll be here. Dr. Ramachandruni's here. If there's any questions at the end of the briefing that the media may have to help communicate to the public. Let's talk now about the statistics for the day in terms of number of new cases and recoveries and persons that are in the hospital. So for today, we're reporting 329 new COVID-19 cases. That's a little bit better than yesterday. We have a little less than 170 cases than yesterday, or about a 44% decrease in number of new cases, but still a pretty significant number, 329 new cases. There's been a few more recoveries since yesterday, and so this chart here shows us total number of cases in terms of active cases, numbers of persons that have recovered, and then the number of deaths. So our active cases is about 6,800 more or less, 6,700. That's about 87% of all the cases. And so we have just under 1,000 persons now that have recovered, and we have 75 deaths reported through today. And then when we look at number of persons in the hospital, hospitalized patients who are recovering from COVID-19, we have somewhat of a significant increase today. 50 more persons than yesterday are in the hospital, about a 14% increase. So 387 people are in the hospital, hospitalized, recovering from COVID-19. The number of those persons that are in the hospital that are in ICU, intensive care units recovering, grew by 3. So that's not too bad, but still 109 in ICU is a big number, and it's a strain on capacity. 3 more in ICU today than yesterday. And then our number of deaths, which has been a big problem for us in July, has grown by 5 persons today. So there were 70 reported yesterday. Today, there's 5 additional for a total of 75. And for those that may be viewing for the first time, you can see a big increase in our deaths happen here in July. In fact, the majority that we're reporting, the majority of the 75 happened in the month of July. And so this is from our big community-wide spread that's currently underway. Okay, I think we have 1 or 2 more slides I wanted to cover real quick before Annette comes. Oh, okay, we have our 7-day daily average one, sorry. This one shows our trend line, which is in the red. It shows a running average of number of new cases. And the blue bars are the number of new cases per day. And so what you can see is back here, when we were reporting oftentimes 0s or 1s, 3s, 5 new cases a day, that's when things were good. And you can see the line was pretty much flat line. There was a little bit of a increase there when we had the breakout at the meat processing plant and some of our senior facilities. But this is a real story here in July. Massive number of new cases every day. a trend line going upward. And that's what we have to change as a community. And that's what Judge Canales and the mayor have been talking to us about, especially the last couple of days. You can see our trend line is flattened a little bit. Today, the 7-day average is 372 new cases every day. That's the 7-day average. It's a couple of cases less than yesterday, but still, it's way too high. 372 average new cases every day is what we're saying in Nueces County. Okay, so that concludes the statistics. Now, yesterday, the judge and the mayor imposed orders on restricting access to beaches, and we put together a graphic to make it real clear. There's a lot of calls last night, and I was working with several community leaders to make sure people understood. There was a little bit of confusion because we have two sets of beaches. We have the Bay beaches up here near downtown. That includes North Beach and McGee Beach. And then we have our Gulf beaches, our Padre Island beaches. And there's slightly different rules for each of those two areas. And so we put together this graphic today so you can see what the restrictions are or are not for each one of those beach areas. So when it comes to vehicle access, can I drive my car on the beach? On either beaches, whether it's the Bay Beach or the Gulf Beach, the answer is no. No vehicular traffic on the beach. That's that first one. When it comes to exercise, can I jog on the beach? Can I do some strength conditioning on the beach? Can I do aerobics on the beach? The answer is yes, and you can do it on both beaches, right? The Gulf beaches or the Bay beaches. Can I swim? Can I swim in the water at either of the beach locations? The answer is yes, you can swim as long as the beach is open. Remember, there is a curfew in both beaches. So swimming is allowed in both beaches. Can I social gather? Can I have a group of 20 people? And we'll social distance, but we want to have 20 people in a group? The answer is no. That's imposed by the governor. So the governor's order says no groups larger than 10. And so group gatherings, social gatherings of 10 or more on either beach, the Gulf Beach or the Bay Beach, is not prohibited. Okay, so that's a no on both. Can I lie down? Can I take a towel or some type of a cot and just lay in the sun on the beach? You can on the Gulf beaches, yes. But on the Bay beaches, North Beach and McGee, you cannot. The city has imposed that order through Mayor McComb. There's signage that's posted, so no laying down on the Bay beaches. Can I do overnight camping? Can I pitch a tent and stay on either beach overnight? The answer is no on both, and the reason is because we have a curfew. The orders that the judge put in place and the mayor has a curfew for the beaches, meaning no people allowed on the beaches from sundown to sunup or from 8:30 to 6 a.m., so no overnight camping. Can I pitch a tent, whether it's one of those ones from Academy to help block the sun or one that you might use in the woods? You cannot on the Bay beaches, so no tents allowed, but you can do it at the Gulf Beach, okay? Can I sit on the beach, whether I'm sitting on the sand or a chair? You can on the Gulf beaches, but you cannot on the Bay beaches. And then finally, can I put a chair and sit or put stuff on it? You can on the Gulf, but not on the Bay beaches. And so basically the rule of thumb for the Bay beaches is you have to be in motion. You can't sit, you can't lay, you can't go under a tent. On the Bay beaches. You can on the Gulf, though. There's one other one we have to add to this, which is fishing. We have to add fishing. And can you fish? And the answer is yes, you can fish at either the Gulf or the Bay beaches. So that's it. That's a summary. We'll put this on our website, and we hope that this helps clarify any confusion that may have existed from our material we presented yesterday. Okay, I think that's it. I did, you know what, I have one other sheet of paper. I'm just going back to the school districts. Let me just read off in case anybody has any questions whether or not your school district is involved in the closure, or not the closure, I'm sorry. The order that Dr. Ramachandruni put into place. And so I'm going to read these off just one at a time. So Toloso Midway is one of the school districts impacted. Corpus Christi Independent School District, Flower Bluff, and that one is somewhat tentative based on their school board meeting next Tuesday. Cal Allen ISD, London ISD, and then West Oso ISD. The 12 school districts include Agua Dulce, that one's in the order, Driscoll ISD, Bishop, Robstown ISD, that's in the order for no class instruction until after Labor Day, Banquete, and then Port Aransas. So that's the list of 12 school districts to which the order that's imposed by a local health authority, Dr. Ram, prohibits any type of in-class instruction until after Labor Day. All right? That concludes my remarks. We're going to have Gabby translate those into Spanish, and then we'll be here for any questions that the media might have.
Quiero agregar más información a la orden del Dr. Ramachandruni. Esta semana que nos reunimos con los superintendentes de las escuelas del Condado de Nueces, desarrollamos un consenso para esos distritos escolares, con excepción del Distrito Escolar de Flower Bluff, quien tendrá una reunión especial el día martes a las 6 de la tarde. La orden que dio el Dr. Ram va a estar disponible en nuestro portal y es vigente para todos los grados y no aplica para las actividades extracurriculares, solo para las clases en persona. No van a estar permitidas las clases en persona sino hasta el 7 de septiembre. Esa orden pudiera extenderse, ya lo decidiremos cuando se acerque la fecha. Así los maestros, los estudiantes y los padres de familia estarán despreocupados por salir de sus hogares. En cuanto a las cifras por los resultados positivos debido al COVID-19, el día de hoy se reportaron 329 casos confirmados por el virus, haciendo un total hasta la fecha de 7,861 casos. 998 personas se han recuperado por completo. 387 continúan en el hospital, esos son 50 más en comparación del día de ayer. 109 personas están en la unidad de cuidados intensivos. 6,788 casos continúan activos. El día de hoy se reportaron 5 fallecimientos adicionales. Hasta la fecha son 75 las personas fallecidas. Ayer el alcalde y la juez dieron a conocer el cierre de playas y parques. Existe algo de confusión por las playas de la bahía y del Golfo. Las reglas son algo diferentes para las playas de cada área. En ninguna está permitido el acceso a los vehículos. Se puede nadar en todas las playas. No están permitidos los grupos de personas en ninguna playa. En las playas del Golfo se puede asolear, pero no en las playas de la bahía. No está permitido acampar en ninguna de las playas. Poner carpas solamente en las playas del Golfo. Todos los detalles están publicados en nuestro portal de la ciudad. Y en cuanto a la orden emitida por el Dr. Ramachandruni, este va a impactar a los distritos escolares de Tuloso Midway, CCISD, Flower Bluff, dependiendo de la junta del martes, Cal Allen ISD, London ISD, West Oso, y en el Condado de Nueces, en Agua Dulce, Driscoll, Bishop, Robstown, Banquete y Port Aransas.
Good afternoon. Annette Rodriguez, Public Health Director. The following is a personification of COVID-19. This is a letter written from the desk of COVID-19. Dear Coastal Bend residents, I am COVID-19, and most consider me an unwanted guest. My visit here was not meant to last this long. In fact, in March, I was just about to leave, but something happened, and my departure was delayed. But I still did not intend to stay. Over the next 3 months, I gradually became more comfortable and eventually settled in. Currently, I'm happy to report there are over 7,860 people here in Nueces County that have invited me to stay with them, and 70 deaths that were directly related to me. Even though I didn't do that on purpose, they didn't seem to be very healthy people, and others, I'm not sure what happened to them. I feel very welcome here, and I am reconsidering leaving altogether. Listen to me. I know I am an unwanted guest. Many of your lives have been turned upside down because of me, COVID-19. But just forget about all that sadness and grief. Don't kick me out of Nueces County. Don't stop me from spreading or from killing any more of your loved ones. In the absence of a vaccine against me, you have weapons that you could easily stop me from spreading the way I have. Some of the other places I have visited all are using those things, but many of you have chosen not to use them here. So thank you, Coastal Bend residents, for not using those tools and allowing me to continue to jump to you and others quite easily and continue to send many more of you to the hospital every day. There's a lot going on in there. I'm actually thinking I'm just going to stay here in the Coastal Bend for good. Many of you are so welcoming, and have even invited me to meet your friends. Also, thank you for not wearing those masks when you go out. Wearing a mask makes it twice as hard for me to visit your friends. I've heard you say that you hate them, and I agree completely. So thanks again for not using them. You also have another very scary tool called social distancing. You humans love to be close to others, and that is why I'm so happy here. Thank you for getting so close to each other when you go out in public. That makes my life and my ability to replicate much easier and super fast. When you use both strategies, wearing the mask and social distancing, you make it nearly impossible for me to replicate and infect others. But I've noticed that many of you barely do one of those strategies, more or less both strategies at the same time. Also, I was just visiting for a short time here, and you were the one that took me with you to work, sick. Having a suppressed immune system makes it super easy for me to replicate, and I agree with you. Why not go to work while you're sick? You still need a paycheck, and your boss didn't seem to mind if you went to work sick. If he doesn't mind and you don't mind, I definitely don't mind either. I really would love to visit your boss next. He seems very cool to COVID-19. To be honest, I'm tired of hearing about all those public health prevention strategies, such as washing your hands, avoiding people who are sick, disinfecting those surfaces where me and my buddies hang out. We are just fine with having dirty hands. Washing your hands is overstated. I like dirty hands, and I love when people with dirty hands touch their eyes or their nose or their mouth, because I can just jump right in and have a nice long visit with them. That's when they let me lie down with them for days at a time. They're coughing and they're having trouble breathing, but come on, it's not too bad. We're friends now. I have found so many new places to hang out in Nueces County, and because I am new, you will never know how I will affect you. So continue to stay really close to strangers, and remember, don't wear a mask, and then I will be with you and all of your friends, and I'm even willing to go meet your families. Don't adjust your lives in any way because of me. Keep doing everything like you were before I arrived. I know you want to stay because you don't use any of your public health. I know you want me to stay because you don't use any of your public health measures. Thank you for such a warm welcome here. Yours truly, COVID-19. I'm not here to make up stories. I'm not here to entertain anybody. I'm hoping that if you hear this from the perspective of the virus, maybe you will more easily be able to understand how that virus is spread. Please don't allow COVID-19 in your lives. Help us to kick COVID-19 out. Do your part. Stay informed, stay well, and as always, stay protected. Thank you.
La siguiente es una personificación del COVID-19 desde la perspectiva del virus. Es una carta escrita desde el escritorio del COVID-19. Estimados residentes del área de la costa, soy COVID-19 y la mayoría me considera un invitado no deseado. Mi visita aquí no estaba destinada a durar tanto. En marzo estaba a punto de irme, pero sucedió algo y mi partida se retrasó, pero aún no tenía la intención de quedarme. Durante los siguientes 3 meses me sentí más cómodo y finalmente me instalé. Actualmente hay más de 7,000 personas en el condado de Nueces que me invitaron a quedarme y 70 muertes que estaban directamente relacionadas. Muchas de sus vidas han sido dañadas por mí, pero olvídate de toda la tristeza y el dolor. No me eches del condado de Nueces. No detengas mi propagación o la idea de matar a tus seres queridos. A falta de una vacuna que me detenga, tú tienes las armas que evitarían propagarme. Algunos lugares usan otras armas, pero mucha gente ha elegido no utilizarlas. Así que gracias a quienes no me detienen y me permiten continuar brincando de persona en persona, algunos terminan en el hospital. Te agradezco por no usar cubrebocas, ya que esas me dificultan visitar a tus amigos. También te gusta el distanciamiento social. A mí me gusta estar cerca de tus amigos y familiares. Me llevaste a trabajar contigo y a tu jefe no le importó que yo estuviera ahí. Tal vez también a él lo visite después. Estoy cansado de escuchar sobre esas medidas de prevención de salud pública, como lavarse las manos, evitar las personas enfermas y desinfectar las superficies donde yo y mis amigos pasamos el rato. Estamos bien con que tengas las manos sucias. Lavarse las manos es exagerado. Me gustan las manos sucias y cuando las personas se tocan los ojos, la nariz y la boca, puedo saltar y tener una agradable visita con ellos. No ajuste sus vidas de ninguna manera por mi culpa. Siga haciendo todo como era antes de que yo llegara. Sé que quieres que me quede porque no utilizas ninguna medida de salud pública. Gracias por una cálida bienvenida. Sinceramente, COVID-19.
Tracy, is it working yet? It is back up. It's back up? Okay, we should have sound at this point. We had some technical difficulty. So I'm going to see if anybody tells me on Facebook if they can hear me. Okay. Well, you guys missed the rest of the story, so we may have to bring you back tomorrow, Annette, to do the rest of that story, maybe. Okay, just one other thing, and then we'll see if there's any questions. So during the briefing, the school board president of London, Shirley Thompson, let me get a last name right here. Hold on just a second. Thornton. Sorry, Shirley. So Shirley Thornton, who is the school board president of London, wanted me to know, and I want the community to know, that she's pretty confident the school board is going to be in agreement with the order that Dr. Ramachandruni put into place for the 12 school districts. The real purpose for the school board meeting is to allow staff to give the opportunity to inform the board and their parents about what to expect with the registration, online learning, and a hybrid format when the virus settles down. So the emergency school board meeting next Tuesday is more about getting information on what is the distant learning going to be consisting of, and it won't be the board taking a vote as to whether or not we want to accept the orders, because the orders are imposed by statute by our local health authority, and they're effective really without a school district's vote or not. Okay, so we thank Shirley. Thanks for that clarification via a message during the meeting. Okay, so with that, we'll see if there's any questions from the media.
This is about the in-person school restrictions, so whoever.
Okay, I'll try.
Okay.
Yeah.
Mainly just why sports were exempted from that.
Right, so one of the main reasons is the sport is regulated by a different entity, like the ULI. They set rules on when you can start practicing, how long, and that type of thing. So many of the superintendents felt that that is regulated by a different governing body, and so exclude it out of the order, which we were okay with that recommendation.
Okay.
Yeah.
And there's people on our live stream also asking questions about why private schools and charter schools.
Okay, right. We should have brought that up. So through today, we have met with most of the school types. So that includes private parochial schools. We had an hour-long meeting with most of them today. And we have begun the conversations with charter schools. And so let me begin with charter schools. Charter schools are very similar to the public school in that they get state funding, and by all intents and purposes, they're a public school. We have to have more conversation with them. We haven't had that yet, but we believe we'll have a second order that'll be tailored just to the charter schools. So we're pretty confident that the same order will be imposed on any charter school, and we'll announce that to the community when we have consensus amongst the charter schools. The parochial and private schools, we're still working with them. We need to make sure we have the necessary legal right to do what Dr. Ramachandruni did today for the public schools. And we need to talk to them one more time just to make sure we have consensus amongst them. So more information is coming out on those two types of schools by tomorrow.
Okay.
Yeah.
Thank you.
That's a good question. Thank you. Yes, sir.
Just one more. Is this going to be very fluid week by week? I know you talked about
Yeah.
it. Can you kind of just a little bit
Right.
elaborate a little bit more?
Sure, I can. So the order is definitely in effect without, this won't change, as our indicators are pretty confident won't change. So no in-class instruction until after Labor Day. But leading up to Labor Day, as we told the superintendents today, we'll be talking with them. We'll be working with our scientists, professors, our own health district, and we'll be evaluating the situation. And if the cases are as great as they are yesterday, the day before, in the 600s, 500s, even 300s, it may be a necessity to continue that at-home learning only beyond Labor Day. And in fact, some of the superintendents said that it's conceivable it could go all the way to December, just based on the evidence that we see here today. Our scientists and professors from A&M told us these high case counts, these deaths, the hospitalizations, the problems with lack of hospital space is only going to get worse over the next couple of weeks. So we're going to continue to monitor it, and we'll advise the community and the parents, and we'll work with the school districts. But that is a good point. This is not all we have to get to is Labor Day and we're home free. It's that we're going to monitor this, and it could get worse. We're expecting it to get worse, frankly. And so it could go beyond, and that's in fact why there's a statement in the order that Dr. Ramachandruni issued today, which says if necessary, this order will be extended. Okay, any other questions? Okay, great. So today is today's Thursday. Okay, today's Thursday. Thought it was Wednesday, Annette, but so tomorrow is Friday. So tomorrow we'll have Dr. Bird here from Texas A&M Corpus Christi, and Nueces County Judge Barbara Canales is here today. She's not speaking, but we'll have her here tomorrow. Mayor Joe McComb, myself, Annette Rodriguez. But the majority of the time will be dedicated to Dr. Bird from Texas A&M, so he can inform us of his updated trend lines and tracking information that he's been doing. All right, so we thank you for watching. Remember our messaging to stay home as much as possible. Keep your face mask on when you leave the house. Keep your hands clean as often as possible, and don't touch your face with dirty hands. And stay safe. We'll talk to you tomorrow.